Hello, my name is Ami Sungvi, and I'm here to talk to you today about disparities in mental health care. Mental health is a topic that is finally being openly addressed. In order to continue the conversation around mental health and how there should be no shame in seeking help, we need to address the disparities among different races and ethnicities. Especially among children in the foster care system, there are disparities based on race. According to an article by Anne Garland, John Landsberg, and Anna Lau, children in foster care show elevated need for mental health services, and there is some evidence of greater unmet need among racial, ethnic minority youth compared to Caucasian youth. Studies have also shown that there is a greater unmet need for care regarding alcoholism, drug abuse, or mental health among African Americans and Hispanics. Without proper care, we risk untreated individuals with mental disorders endangering themselves or others. The bill that I am proposing would allow more access to mental health care for minorities and the economically challenged. I propose a bill that would make mental health care a standard part of an insurance plan. It would no longer be considered a specialty practice, but a general practice medicine. This would also mean that it is a service that would be provided by the government for children in the foster care system. Coverage for mental health care is being given widespread consideration because of general pressures to reduce health benefit costs and because of increased attention being paid to the relationship between physical and mental illness. I strongly feel that if this policy is enacted, it will drastically lower childhood obesity rates, suicide rates in teenagers, and lower criminal activity as well. This is an issue that is not affected by political party. It is for the benefit of millions of Americans that do not have mental health needs met, and it is affecting other aspects of their lives drastically. There are many cost benefits to this policy as well. One benefit would be saving money on emergency mental health treatments, such as having to lock someone in a psychiatric facility for observation when people have a mental breakdown, and other benefits from being proactive about this situation. What you need to take from this policy proposal is that it has benefits if we are proactive about mental health. Depression, anxiety, PTSD, and bipolar disorder are becoming increasingly common, and there are many people that have not been diagnosed or have been able to access treatment options. Members of racial and ethnic minority groups have less access to mental health services than do their white counterparts, and are less likely to receive needed care, and are more likely to receive poor quality of care when treated. Minorities in the United States are more likely than white Americans to delay or fail to seek mental health treatment. Two studies examining trends in mental health care using the Institute of Medicine definition of disparities found no progress towards eliminating disparities in mental health care provided in either primary care or psychiatric settings. In order to pass this policy, you can tell your constituents that it will help lower crime and also help provide care to veterans and the elderly that have Alzheimer's. It will also help children in the foster care system to get the help that they need so that they could be placed with a permanent family and be happy. It will also show your constituents that you're compassionate and that you care about minorities and children getting the help that they need to make a better future for themselves. Mental illness needs to be talked about more frequently, and it needs to be treated as a normal part of the healthcare system.